Hi, my name's Julia. I'm one of the midwives here at OHSU, and today I wanted to talk a little bit about the use of water for labor and birth. I want to talk a little bit about its history in general, as well as the history here at OHSU, and I'm going to cover some of the benefits that we know about the use of water for labor and birth, as well as some of the potential risks. We know that water's been used for comfort and relaxation for centuries. The water birth movement started in the 1970s, mostly in France and Russia. And at that time, the midwives were looking for a little bit more gentle way to birth babies compared to what the common obstetrical practices were. So they noticed that when babies were born into a bath of warm water, that they were generally calmer, they cried less, and they were a little bit more interactive with their moms and more willing to breastfeed earlier. So at OHSU, our water birth journey began in 1997 when a patient came in and presented a book to one of the midwives in clinic and said, "This is what I want to do. I want to have my baby under the water." So over the next 9 months, the midwives carried that through all the committees and approval processes that it takes to get something new in a hospital setting. And that woman, in fact, was the first water birth here at OHSU. Since 1997, we've helped over 600 babies be born into the water, and many thousands of women use the tub for pain management in labor. What do we know about the safety of water birth? Obviously, we can't do random controlled trials with women who are pregnant and laboring. So what we can do is we can compare subjective information, which would be what moms tell us about their labor experiences, and then we can look back and we can compare statistics around APGAR scores, infection rates, and admissions to the NICU of babies that were born in the water and babies that were born on land. And what we do know from the existing research is that water birth is safe for both mom and baby, that there are similar APGAR scores, similar infection rates, and no increased admissions to the NICU if a baby is born under the water.
Before we go too far, I wanted to explain two distinct uses of the water during the birthing process: water immersion and water birth. We think that everyone should consider water immersion during their labor, regardless of whether or not you plan to actually give birth underwater, because water can be so helpful in managing contraction pain. Warm water is also really helpful because it allows a lot more buoyancy, freedom of movement, and can help as the baby's moving down through your pelvis to relieve a lot of that back and hip pressure that you'll experience. Remember that your partner is invited to join you in the water, so when you're preparing your birth bag, remember to bring either swimsuit or something that they would be comfortable wearing in the water. When we're talking about water immersion, we're talking about your abdomen being fully submersed in warm water. We know that this helps relax the uterine muscle, improve blood flow to the placenta and the baby, and really provides a nice sense of comfort and peace while you're laboring. We do want to make sure when you get in the water, it doesn't slow the labor process down, which can happen if your labor isn't really far advanced. And this will be a conversation that your midwife will have with you while you're in labor, so you can decide together when the best time is to get into the tub. As midwives, your safety of you and the baby is really important to us. And so there's a couple things we do to safeguard this. First, we want to make sure that you're staying really well hydrated. We have a water bottle we can provide you with, or you're welcome to bring your own. We'll also be monitoring the temperature of the tub really closely, as well as your and the baby's heart rate to make sure that everyone's doing really well while you're in the tub. If we notice any increases in the temperature or you're in the baby's heart rate, we may ask you to get out of the tub, and once that has normalized, we'll often invite you to get back into the tub. For a variety of reasons, the number of people who actually give birth in the water ends up being relatively low to the amount of people who use water immersion during labor. And regardless of whatever your intent is, we still encourage you to plan to get in the water for the labor process, regardless of what the ultimate outcome is. If you do plan to give birth under the water, we'd like you to watch our companion video for that. To use the water tub for water immersion during your labor, you will be having only one baby whose head is coming first, have a baby that's coping well with labor, be at least 35 weeks for water immersion or 37 weeks for water birth, have viewed this video and discussed your plans with one of our midwives, received personalized counseling about this option, and then sign our consent form. These are some specific situations in which you cannot use the tub for water immersion or birth in the water. Preeclampsia, which is when you have high blood pressure with protein in your urine. An active infection, such as genital herpes, or if you're positive for hepatitis B, hepatitis C, or HIV. If we need to monitor your contractions or the baby's heart rate using an internal monitor. If there's any difficulty with monitoring the baby's heart rate with our wireless monitors or Dopplers, or if you have any abnormal blood pressure, heart rate, temperature, or any other concerning signs for infection.
So hopefully this video has given you some more information about the use of water for your labor and or birth at OHSU. We encourage you to take your questions back home and talk to your support people and people you're going to have with you in labor. It might be particularly helpful to share this information with family members who might be skeptical about the use of water for birth. We'll have a resource section available for you online that you can access at any time, and we want you to bring your individual questions back to the midwife in the clinic. If you do choose to use the water tub for your labor and birth, we will have you sign a consent form at about 36 weeks. It covers the benefits and the potential risks of water birth that we've talked about in this video. Be sure to bring any individual questions to your clinic appointments with the midwife. We're happy to talk about those with you at any time. And before we go, we also have answered a few of the most frequently asked questions for you here in the video.
I like the idea of the tub, but I'm not so interested in delivering in the water. Can I get out for the birth?
Absolutely. You're welcome to get out of the water at any point. Many women enjoy utilizing the water for immersion during labor and may not know until the moment that you're there whether or not you want to stay in the water or ultimately get out. So the midwife and your nurse will assist you at getting out of the tub at any point. Also remember that each room has a bathtub and a shower that you can utilize for other ways to have warm water help you during the labor process.
How do you keep the water warm in the inflatable tubs?
Great question. We do have a really narrow range that we like to keep the temperature in the tub at for the safety of you and the baby. So often we'll end up removing some water and adding more warm water in to keep it at that perfect range.
What's the fishnet for?
You've probably heard, and it's true, that a lot of women poop while they're pushing, and it's totally normal. We'll use the fishnet to help clean the tub, keep the tub as clean as possible. If you do have diarrhea while you're in labor, we will have to drain the tub and have you get out of the tub. So if you're considering using castor oil, keep that in mind.
Can I be in the water with an epidural?
No, you can't use an epidural and be in the water at the same time.
I've heard that there's less tearing in the water.
Yeah, research is unclear regarding tearing in the water. When women are having unmedicated births, they tend to have a lot more control over the sensation they're feeling as the baby's head is descending. So it's possible that they're able to tear less because they can control as the head is being born. It's also possible that the warmth of the water helps increase blood flow to the perineal area, which could also help decrease tearing.